The organization is the Campaign for Healthcare for Everyone, Louisiana. The reason we're here tonight is that we're holding a candlelight vigil called Dying for Health Coverage, Healthcare Saves Lives. We know, according to the Institute of Medicine, that 667 people died every year during the period of 2005 and 2010 because they did not have health care. And we know that people are continuing to die in the state of Louisiana simply because they cannot get preventative and routine medical care, and they're showing up in emergency rooms, and sometimes they show up too late. So we're trying to put a face to this issue and to make sure that the public knows that this is a serious issue. Healthcare is not a luxury. Healthcare is a necessity. All of us need healthcare.
You just call on your brother when you need a hand. We all need somebody to lean on. I just might have a problem that you'll understand. We all need somebody to lean on.
We're here with a candlelight vigil called Dying for Coverage, Healthcare Saves Lives. We're here on behalf of the Campaign for Healthcare for Everyone, Louisiana, which is a group of more than 35 organizations and many, many more individuals who are working on behalf of the citizens of Louisiana to get our Governor Jindal, and our policymakers to provide access to health insurance for the people of Louisiana.
Governor Jindal says we can't afford to expand Medicaid in Louisiana. Well, we can't afford not to expand Medicaid in Louisiana. Governor Jindal is turning his back on millions of dollars in federal funds. He's turning his back on over 200,000 Louisiana residents and scores of hospitals and clinics throughout the state that struggle to find ways to provide care to people with limited means and no health care coverage. When I'm working in the hospital, I admit patients every night who wouldn't be there if they had coverage that would provide medical follow-up, preventative care, and medication. When I'm working in the schools, I meet parents every day with serious medical needs, or grandparents that are going unmet. Their children have Medicaid and the CHIP, but most of the parents and grandparents and aunties that we work with don't. A few examples just from the past couple of weeks. I admitted a young man who's 22 years old, type 1 diabetic. So when we think about people who are sick, we usually think about people who are elderly, but there are many young people with chronic medical conditions who are able-bodied, who can work. But what 18-year-old, 22-year-old is going to be able to get a job that has decent health care benefits? Hardly any of them. So we see these young people all the time. This young man was type 1 diabetic. He came in and diabetic ketoacidosis, had to be admitted to intensive care unit because he hadn't been able to afford his medications. And another young woman I admitted, she was only in her 30s. She had had a heart attack 2 years previously, but once again had been unable to get appropriate follow-up or medications because she didn't have any health care coverage. I had another young man who had been diagnosed with cardiomyopathy, which is a very enlarged heart. They don't know why. Maybe he had gotten it from a virus. So he even had a pacemaker. So we admitted him because he was in with heart failure. None of these young people should have been admitted to the hospital. If they had had healthcare coverage that provided appropriate follow-up and medication, we wouldn't have had to see them in the hospital. Talked about the parents that we see. I had a mother that was in tears because she needs surgery. She has a severe female condition that needs surgery, and she's trying to figure out how she can afford this. I had another family. The father, he wasn't that old, he was only in his 40s, and he had a heart attack in the fall, and because he wasn't able to afford his medications and follow-up, once again, he had another heart attack. Had another family that came in. The stepfather had bipolar disorder. He had Medicaid at one time, had been cut off of Medicaid, couldn't afford his medications. He didn't know how to arrange things so that he could get it through the local mental health center. He had ended up trying to tough it out, became very depressed, ended up having to be hospitalized. All of these things should have been avoided, and if these families these adults had Medicaid coverage, I don't think that we would have had these bad outcomes. Anyway, okay, to wrap it up, I implore Jindal and our legislators to accept the federal funds to expand Medicaid. It's the right thing to do, to put patients over politics. Thank you very much.
Today we learned that the legislature here, the legislators are going to be taking up several bills. There are 4 bills that are opposing expanding Medicaid and providing health care coverage to people who are uninsured. Now, I don't understand that. I can't figure out why anyone would oppose and propose legislation to stop the state of Louisiana from taking federal money and providing health care coverage to people who are uninsured. But we have two legislators, Representative Hollis and Representative Richard, who have introduced such legislation. There are 4 bills. We have a little slip like this that was passed around to everybody so you could see what those bills are. Those bills are going to be scheduled to be heard on Wednesday in the House Health and Welfare Committee, right here in this building behind us, over here in the House chamber. We want everybody that's here to come out and oppose that if you can, to show up and oppose those actions that these legislators are trying to take to block our state from providing health care coverage and saving lives, affording people basic health care coverage. We also have on the other side of the chamber, on the Senate side, on April 23rd, we have a bill by Senator Nevers that's going to be heard that is in favor of accepting Medicaid funds. We want you to show up again on the 23rd and support Senator Nevers and the legislation to afford people basic health care and insurance in this state. So on that piece of paper, you have the bills, you have the dates. Please tell everybody you know. Spread the word. We need people to show up and let the legislators know that this is something that we as citizens care about. The proposed legislation by Senator Nevers is a constitutional amendment. What that constitutional amendment would do, if it's passed, is it would allow a proposition, an amendment, to be placed on the ballot for the elections in the fall. And you and I and every other registered voter in Louisiana who chooses to do so would be able to vote, to go to the polls and vote on whether or not you think people in Louisiana should get health care coverage, and we should accept and use those federal dollars for providing health care insurance to adults in this state. Is there anybody here who doesn't think we should take those federal funds and provide health care coverage to people in this state? Do you think we should?
Yes!
Do you think we should?
Yes!
I'm Veronica Freeman. I'm here tonight as an advocate, and I'm here to speak on behalf of my mother. My mother's story is so similar to so many people in the great state of Louisiana. My mother worked all of her adult life, and at the age of 52, she had a stroke. When she had a stroke, unfortunately, she was unemployed. She had no medical insurance. She was forced to use the charity system. Upon their discovery, they also realized she was a type 2 diabetic, which meant that she would have health problems for the rest of her life. We were able to get her through the charity system with minimum care because she didn't have any health insurance. And when I say minimum care, Thank you. And when I say minimum care, it was a struggle every month to make sure that she had the medicine that she needed. She had to pay out of pocket for her medicine at the tune of $875 each and every month until she was able to qualify for Medicare. Once we were able to get Medicare, it seems that every service that she needed to help make her a little bit more mobile and independent, she was $30 over. Unfortunately, 5 years later, my mother lost one of her legs to diabetes. She moved in with me and my daughter. It was a struggle. 2 years later, she got colon cancer. Again, she was still $30 over. Then, 5 years later, she ended up with lung cancer. It was a struggle every month to make sure she had all of the necessary medicines and the services that she needed. Because as we know, Medicare will help you to see a doctor. It is Medicaid that helps to provide you with the services that you need to live a very quality life. It even got to the point that we tried to apply for Medicaid several times in 1 month because her health began to deteriorate very fastly, and she didn't necessarily want to go into a nursing home because that was the only way that we could really get the services that she needed. And so someone suggested that I actually give her custody of my daughter to see if that would bring down her income. Medicaid called my home, spoke to my mother, and told her that she was still unable to get Medicaid, but they would give my daughter a Medicaid card. I thought that was the most ridiculous thing I had ever heard in my life. I was forced to put my mother into a nursing home in order to get services that she needed because we could not care for her at home. 2 years ago, my mother passed. And as I began to think about all the people in Louisiana, I wondered how many more were falling through the cracks because they did not have Medicaid expansion to help them. This program can help so many of our families. And if you think it does not impact you, think about your grandparents, think about your parents as they began to age. What will become of them? And are you able financially to give them the services that they actually need to have a quality life?
My name is Jackie Blaney. I work for Independent Living, an in-home supports provider, and I'm here to honor the life of Geraldine. If Geraldine were here, you'd know it. For one thing, she stood about 1.5 feet taller than me, so you couldn't miss her. For another thing, she would not be a stranger to anyone. By now, she would have worked this crowd, and everybody would know her name. And not only that, by now she'd have us all laughing about one story or another that she found to be funny. Geraldine moved to Baton Rouge from New Orleans shortly before Katrina and dedicated herself to providing support to people with disabilities and people who are older to prevent institutionalization. She dedicated herself to one young lady in particular that we all held very dear. If Geraldine were here, she would say, you know what time is it? Because I need to get back to work. If Geraldine were here, she would say, it's not about me, it's about doing the right thing. Geraldine was very dedicated to her church. If Geraldine were here, she would say, you know what? They call themselves Christian? I don't know. If Geraldine were here, she would be the first to step up and say, what can I give? How can I help? Geraldine worked 40, 50, 60 hours a week to ensure that the people that she supported had the best possible support to stay out of institutions. When Geraldine